Welcome to Professionalism in Medicine, Personal Accountability. Our objectives for this course will be to list the responsibilities related to personal accountability in both academic assignments and clinical practice, including participation in group tasks and preparedness for clinical duties. You will develop and implement a personal action plan that demonstrates accountability, such as notifying supervisors of limitations and meeting deadlines, and assesses effectiveness through self-reflection and peer feedback. Key components of personal accountability found in the PA Policy Manual include 1. Participate in group and class assignments responsibly to the best of one's abilities. 2. Participate responsibly in patient care to the best of one's ability and with appropriate supervision. 3. Be present for your clinical assignment and prepare to complete your duties as assigned by your preceptor. 4. Notify faculty and clinical preceptors if unable to perform a clinical task effectively. Our first case, participation in group and class assignments. Lucy, a first-year physician assistant student, is part of a study group preparing for an upcoming GRAT in pharmacology. The group agreed to divide the study topics, with each member responsible for reviewing and summarizing key concepts before the final review session. However, Lucy procrastinates and does not thoroughly prepare her assigned section. During the study session, she provides vague explanations and struggles to answer her classmates' questions.
Let's explore how taking ownership of your learning responsibilities strengthens both your academic and clinical performance. How does Lucy's lack of preparation affect the group's success?
Her vague explanations disrupted the group's momentum and left others unprepared. This has not only created confusion, but also undermined the group's collective effort and trust.
What could Lucy have done differently to demonstrate accountability?
She could have communicated earlier if she was struggling, asked for help, or requested more time. Preparing ahead of the session and reviewing her section thoroughly would have shown reliability and respect for the group.
How does personal accountability in group study settings translate to clinical practice?
In medicine, your team relies on you to be prepared. Just like your peers depend on your section in study groups, your patients and colleagues depend on your knowledge and follow-through in clinical settings.
Personal accountability takeaways. Accountability means fulfilling commitments, especially in collaborative learning. Lack of preparation can hinder group success and erode trust. Teamwork relies on each member being responsible for their role, just as in patient care. Some strategies for academic accountability. Use active learning techniques. If you can teach it, you understand it. Summarize concepts in your own words. Use flashcards, diagrams, or quizzes to boost retention and comprehension. Master time management. Plan early, stress less. Break large tasks into smaller chunks. Create a steady schedule and avoid cramming the night before. Embrace accountability. Your preparation helps everyone thrive. Treat group study like a team sport. Come prepared, contribute meaningfully, and lift others as you learn. Our next case study, participation of care under doctor supervision. Luis, a clinical year PA student on his surgery rotation, is assisting in a post-operative care. His attending physician asked him to assess a patient's wound and report on any signs of infection. Luis carefully examines the wound, but is unsure whether the mild redness around the incision is concerning. Instead of making assumptions, he documents his findings and informs the resident, who reassesses the wound and confirms is within normal limits.
Let's look at how thoughtful, responsible actions during clinical training protect patients and build trust. How did Luis demonstrate accountability in his approach to patient care?
Luis did not guess or pretend to know. He documented what he observed and promptly consulted the resident. This shows integrity, prioritization of patient safety, and respect for clinical hierarchy.
Why is it important for PA students to seek confirmation when unsure about clinical findings?
Because uncertainty is a normal part of learning, what matters is how you respond to it. Seeking help ensures the right care is delivered and builds your clinical judgment through real-time teaching.
How does responsible decision-making in medical training impact patient safety?
Responsible students reduce the risk of errors by acknowledging limits, asking questions, and valuing supervision. This not only safeguards patients, it fosters a strong culture of safety and learning.
Key takeaways. Accountability involves recognizing one's limitations and seeking supervision when necessary. Careful documentation and timely reporting improve patient outcomes. A responsible approach to patient care builds trust among the medical team and ensures patient safety. Some resilience strategies for diligent and safe clinical practice include: develop clinical confidence. Confidence grows with practice and feedback. Regularly perform assessments, ask for input, and treat every encounter as a learning opportunity. Communicate effectively. Clear reporting equals safer care. Be timely and precise when updating your preceptor or team. It ensures no detail is overlooked and builds trust. Stay patient centered. Shift from "do I look competent" to "is my patient safe?" Let patients' well being guide your actions, not fear of making mistakes. Our next case study: responsibility and punctuality for students. Michael, a second-year PA student, is completing his internal medicine rotation. His clinic day starts at 6:30 a.m., but he frequently arrives 10 to 15 minutes late. He assumes it's not a big deal since rounds don't start until 7 a.m. However, his attending noticed his tardiness, and one morning he misses an important pre-round discussion about a critical patient. When asked about the patient's status during rounds, he struggles to provide an update. Later, his attending physician pulls him aside to discuss his lack of punctuality and its impact on the team.
Let's talk about why showing up on time is more than just good manners. It's a patient care priority. Why is punctuality important in a clinical setting?
Timeliness shows respect for your team, your patients, and your responsibilities. In medicine, information and decisions move fast. Being even a few minutes late can mean missing critical updates.
How does Michael's tardiness affect patient care and team dynamics?
He missed vital pre-round information, which caused him to fumble during rounds. This not only undermined his credibility, but potentially compromised patient care and created more work for others. Chronic lateness can also erode trust and strain team relationships.
What strategies can PA students use to ensure that they arrive on time for clinical duties?
Plan ahead. Prepare clothes, meals, and notes the night before. Set multiple alarms or use a smart device that forces you to get up. Arrive early. Aim to be there 10 to 15 minutes before expected start time, not right at it. Be honest if you're struggling. Preceptors appreciate accountability more than excuses.
Key takeaways. Punctuality demonstrates a professionalism and respect for patients, colleagues, and supervisors. Being late can result in missed learning opportunities and negatively impact patient care. Planning ahead, setting alarms, and anticipating possible delays can help ensure timely arrival. So, strategies for professional punctuality: prioritize rest and self care. Tired minds make mistakes. Get quality sleep, hydrate, and manage stress so you show up alert, focused, and ready to care for others. Master time management. Plan ahead like lives depend on it, because they might. Set multiple alarms, account for delays, and build a consistent morning routine that gets you out the door on time. Adopt a professionalism mindset. Your arrival time reflects your commitment. Being early isn't just courteous, it shows that you respect your role, your patients, and your team's time. Our final case study: inability to perform clinical tasks. Emily, a PA student on her emergency medicine rotation, is asked for a resident to suture a patient's wounds. Although she has observed the procedure before, she has never performed it on a real patient. Instead of admitting her inexperience and asking for guidance, she proceeds. Midway, she struggles with technique, requires the resident to step in and correct the mistake.
Let's discuss how professionalism isn't about knowing everything. It's about knowing when to ask. How should Emily have handled the situation differently to demonstrate accountability?
Emily should have communicated her inexperience honestly. I've observed this, but haven't done it on a real patient yet. Could you walk me through it? This would have shown responsibility, protected the patient, and invited valuable teaching.
Why is it important for PA students to acknowledge their limitations?
Because humility in medicine isn't weakness, it's wisdom. Knowing and naming your limits protects patients, models professionalism, and builds trust with your team. Pretending to know puts everyone at risk.
How can asking for help improve patient safety and personal learning?
When you ask for help, you reduce the risk of errors and open the door to hands-on teaching. You learn correctly and confidentially, and your supervisors see you as teachable and trustworthy.
Key takeaways. Accountability means acknowledging one's limits and seeking guidance when needed. Patient safety should always be prioritized over fear of looking inexperienced. Learning in medicine requires humility and a commitment to self-improvement. Some resilience strategies. Adopt a growth mindset. Mistakes aren't failures, they're feedback. View challenges as an opportunity to learn and improve. Reflect, adjust, and keep going. Seek mentorship. When in doubt, reach out. Ask your preceptor or clinical supervisor for clarification, feedback, or a demo. Most professionals want to teach you. Develop self awareness. Patient safety is greater than personal pride. Know your limits. Speak up if you're unsure or unprepared. It's a sign of strength, not weakness. How to foster lifelong learning. Here's a self assessment. Do you ask your preceptors for feedback when performing a new task? Do you embrace accountability in both academic and clinical settings? For lifelong learning, I want you to reflect on errors to improve future performance. Learn to manage your fatigue and burnout proactively, and then seek mentorship and professional development opportunities. Commit to your growth. Recognize when you need guidance and when you can act independently. Respect schedules and commitments as punctuality reflects reliability and professionalism. Practice effective communication by providing and accepting constructive feedback. Our next section will be taught by Professor George Vera, Concerns for the Welfare of Patients. Thank you.